Hi, I'm Tim Williams. I'm the lead litigation attorney here at the firm. In this segment, I'd like to talk about knee replacements. You know, it's not uncommon for a client of ours to be involved in a very serious accident, be that a car accident, semi-truck, fall down on ice or whatnot, but have significant damage to the gliding surfaces of the knee itself. Other times we have folks that are perhaps getting a little bit on in age. They have degenerative changes, some wearing and tearing of the knee itself, the surface of the joints, so on and so forth. And the collision or the incident that brings them to us has caused an activation or aggravation of that condition, meaning that it activated the symptoms from previously having no symptoms at all, or they're having a little bit of symptomology, but it made it much, much worse to the point where the doctors are now left with surgery as the only option to address those symptoms. So let's go to the diagram to explain this in more detail. So here we have a diagram of a knee. This is actually the left knee, and then we're looking at the front of the knee right now. If we take some of the layers off and get down to the knee surface itself, or the joint surface itself, we can see that there are, the knee is a fairly complex structure. We can rotate it. You can see there's ligaments in there. There's this, I'll zoom in. There is this structure here, and it actually provides cushion for the knee itself. There are gliding surfaces. This is like a Teflon type material inside the knee, and that actually provides the nice smooth glide you get when you move your knee, so you're not grinding or feel catching. And these surfaces can be injured in an auto accident, for example, and sometimes, oftentimes in fact, people as they get older, those surfaces tend to wear out, wear thin, and become more prone to injury if someone was involved in like a fall or a car crash. So regardless of the cause, at some point the doctor may decide that this particular client's knee is so far gone, is so damaged, is so irreparably harmed that absent surgery, they're never going to be the same. So they decide, and the patient decides, or client decides to go through with the knee surgery, specifically a full knee replacement. So this video here will walk us through what the knee replacement itself entails. So again, we have this nice gliding surface of the knee. Let's do this. Let's zoom it out a little bit. And remember, as I said, that some people, many of us, as we get older, that nice gliding surface, that Teflon-like material, it tends to wear thin. In this case, you're going to see some severe degeneration in this one, but it actually wears through in some cases. You hear the term bone on bone. This is what the doctors are talking about, that the fact that that gliding surface is now worn through, allowing the underlying bone to become the gliding surface, and now it's literally bone grinding against bone, which causes pain. So as we continue to age, you saw this nice, again, that cushion material there. It starts to desiccate or dry out. It gets thinner. It causes less cushion. These bones now, or the two joints or ends of the joint, the thigh bone up here and the lower leg bones down there, they get closer and closer. You're also losing, as we see, the gliding surface itself. So now you're getting more pressure, less room, less cushion, and you're bone on bone. So it's incredibly painful to go through. And again, this can be caused from an accident where it shears some of this off, or it can be caused from an aggravation of some condition like this that was already occurring. So moving forward then, you can see additional changes there. We saw some changes along the bony edge there. It got bumpy. Those are what the doctors would call osteophytes, or what you and I would call bone spurs. So the bones start to spur, again, reducing that cushion, reducing that space, making it more likely you're going to rub bone on bone and experience pain as a result. So that clearly does not look like a very smooth gliding surface, and that becomes the issue. So the doctor, if he or she looks at an imaging study, an X-ray, for example, or MRI, and they see this, they may tell you that the only way to get rid of your pain, frankly, is to replace the knee itself, the joint of the knee. So this is how they go about doing that. So they would move the kneecap. That was a kneecap there. They actually move it out of the way, and they start shaving off portions of that joint itself. You see, they'd be removing that joint, the bad gliding surface of that joint. They would create a channel there in the thigh bone. They would remove the entire top, the lower leg bone, and then they drill some holes for attachment points for the material, the hardware that's going to go in there here in a second. So you see a large hole at the bottom, a smaller hole at the top, and then the doctor would then use these this pins that would go into the hole. So that now creates the bottom portion of the joint. This creates the top portion of the joint. And then you have that cushion material. Remember the cushion material I showed you that it got desiccated, it got thin. This replaces the cushion material. So they add this cushion, usually it's like a rubber or silicone type substance, that they put it in there. And then they remove the bottom portion of the kneecap. They replace it with another nice gliding surface there, put the kneecap back in place. And then you have some healing that occurs. And so the metal that they put there is actually rough. And so when they cut that bone, it creates a healing response that the body would go through, and it would essentially cause that bone to heal into the rough portion of the metal, which then it's like cement or like glue. It just kind of glues it right there. Your body does that naturally. And then once that's all in place, you have a nice solid knee. You're able to flex it, extend it. You no longer have all that aggravation with the nerves that are being aggravated by bone-on-bone rubbing. You have, frankly, a nice brand new knee, and most people have a complete resolution of their symptoms, and some people are left with a little bit of symptomology, a little bit of pain in the knee. That at that point is more related to surgery than it is the gliding surfaces, because again, those are already taken out by the doctor.
If you've been injured and need help, Dwyer Williams Charkoss Attorneys will get you the settlement you deserve. Experience gets results.